In the clinics, sometimes we have to deal with patients with polypharmacy that will be problematic either for patients or the doctor. The term of polypharmacy is defined as the use of multiple medications and is prevalent in older populations with multiple diseases. But unluckily, it has been linked to a number of unfavorable outcomes. In this research, we tried to investigate the impact of polypharmacy on wound healing and the occurrence of medications-related osteonecrosis of the jaw following tooth extractions. The secondary aim was to identify patients-related risk factors which might influence the healing status. The inclusion criteria in this retrospective study consisted of patients aged more than 40 years old with a radiological follow-up. Patients with history of craniofacial radiotherapy and malignant and metastatic disease of the jaw were excluded. We tried to divide patients into 3 groups. All the patients were divided into different groups depending on the polypharmacy consisted different types of bone-modifying agents administered, which included polypharmacy with non-antiresorptive drugs, polypharmacy with a combination of antiresorptive plus non-antiresorptive drugs, and the last group is a control group consisted of age and gender matched medically fit patients. And all these patients have undergone tooth extraction in University Hospital Leuven, Belgium. After the extraction, we saw the clinical healing status of the patients, whether the patients have the spontaneous normal healing or delayed healing or osteonecrosis, that is more than 8 weeks, no healing or no epithelialization, and it was recorded based on the clinical criteria proposed by American Association of Oral and Maxillofacial Surgeons and also confirmed radiologically with panoramic radiography. And the results are, in the delayed healing, the odds were significantly higher in 80 plus years old administered with antiresorptive and non-antiresorptive drugs and having a major polypharmacy score. On the contrary, patients administered with antiresorptive drugs with hyperpolypharmacy were significantly more likely to develop Mronley. Smoking and extraction site showed no significant impact on wound healing impairment. In conclusions, wound healing status on patients administered with both non-antiresorptive and antiresorptive plus non-antiresorptive polypharmacy was significantly impaired following tooth extraction. Other risk factors, such as increased age and high polypharmacy scores, also significantly contributed to the occurrence of delayed healing and Mronley.